Welcome to the Generous Benefits Podcast, where we help employers create meaningful, people first benefits that truly make an impact. I'm your host, Amanda Brummitt. Today, I'm joined by our very own Bret Brummitt, founder of Generous Benefits, to talk about compliance items that are often overlooked because they seem too small. But as we'll learn, skipping them can create outsized risk for employers. From POP plans to COBRA to Part D Medicare credibility notices, Bret breaks down what leaders need to know and the steps they can take to stay compliant. Hey, Bret, thanks for being here.
Yeah, always my pleasure.
So, Bret, today we're talking about compliance items that are literally too easy to skip to not do. So, I've already walked our listeners through what those are. So, let's dive right into them. Let's start with POP plans. So, for anyone who doesn't already know, what is a POP plan and why does it matter for compliance?
Yeah. So, the POP plan's entirety goal is to allow an employer to treat their medical, dental, and vision plans on a pre-tax basis for the employee's deductions. So if there's an employer that pays 100% everything, there's no need for a POP plan because it's all employer money. There's no employee money coming out. However, if an employee is paying for those benefits, then there is a need for the POP plan if the employer is going to treat those on a pre-tax basis. There's good reason someone would want those to be pre-tax out of their paycheck because that saves the employee, your valued team members, take-home money. And then as an employer, you do receive a reduction in your FICA taxes. So any money that an employee is running on a pre-tax basis does not come out of your employer's FICA taxes as well. So there is a business reason for it at the same time. The POP plan is a subset of that Section 125 IRS code. When we get full, like that's typically called the cafeteria plan, or where flex plans, dependent care daycare expenses come under that category. But the POP plan is the simplified rule. And I said just for medical, dental, vision, those are your three main categories. There is flexibility in the POP plan of what you put under there, but conservatively, not trying to make mistakes, if you just limit it to those three benefits, plus, the other typical pre-tax benefits is what you should put under those. There are opportunities to put disability plans, some of the accident plans, some of the other worksite plans in those. However, those could have an adverse effect to your employees on payouts. So generally, it's your medical, dental, vision plans that fall in that category on POP plans.
Okay. And then what makes it easy? Is it that your broker does it for you? Somebody will do it for you for a cheap fee? It's something you can do yourself?
They are cheap fees.
Okay.
So broker fee driven, payroll vendor fee driven, just internet document creator fee driven. Most of them are ranging in that 99 to 150 version per year. So we're just talking about a one-time per year document update fee. There are some free versions. With free, there's generally a caveat. So traditionally, your voluntary worksite vendors like an Aflac or Colonial or Transamerica, they will offer to do your free POP plans for you in exchange for being able to market their products to your employees. They also do it because there's some degree of scare and fear about not getting documents signed off for employees for allowing for payroll tax deductions that they do. That overcomplicates what a POP plan really is. And so having the plan, administering it, doing it, it's an easy set of documents. They are canned documents that need to be, have 10 or 11 fields updated every year.
Gotcha. And then what is the risk? If you don't do it, what happens to you? Is it an audit risk? Is it a fine?
Your biggest risk is that you don't have them in place. You do get audited, and then you've got to go back and undo all of the payrolls and payroll taxes back to the time when you didn't have it in place. So you could be talking about going back multiple years and having to redo payroll taxes.
Oof.
Updated withholdings from your employees, paying more on the company part. So it's the ramification of doing something that you think is right because it's a click of the button in a payroll system, but not having the documentation to allow you to do such things and then having to go back. There are some other like penalties, you're listening like some of those $100 per day per violation fees that get in there. If we're being real honest, most of the agencies end up coming to a negotiation on those fees versus what you actually have to pay. And
Mhm.
that's really the lower part versus the pain and the lack or loss of employee trust that you're running an operation correctly.
Gotcha. Okay, so definitely worth a couple $100 a year
Oh
to
my
make
God, yes.
sure.
Yeah,
Yeah.
it's and most brokerage firms do talk about it or do it for you. To be done for you does fall, especially in Texas, and the rebating rules that aren't allowed. So nominal fees are pretty normal in that arrangement.
Okay, cool. Then what about COBRA? Our listeners hopefully already know lots about COBRA because Topher was on a few
Mm.
episodes ago and really explained it well. What are the most common mistakes employers make around COBRA compliance, and why do you put it in the category of too easy not to do right?
Put it in the category of too easy not to do right because the cost threshold is so low these days.
Mm.
I mean, for a group like Topher's or some of our other vendors, we're talking the 60 cents per 75 cents. So under $1 per month per medical eligible employee.
Mhm.
So you've got a group of, at least 20 employees if we're talking about COBRA, true
Mm.
COBRA thresholds. So, 20, 40, 60. I mean, if we're paying, 60 or 75 cents, you got 40 employees, you end up with a bill of $30 per month. Just drafting the letter from your company when someone terminates is going to cost you more in personal time than it does to pay for an administrator. And those administrators take on the penalty burdens of not doing it right. So really you're outsourcing your time and compliance at the same time. So it makes it an organizational no-brainer.
Mm.
The pitfall I really find is employers that say, yeah, but we don't have turnover. We don't really experience that yet. And they wait until their first termination to want to turn the service live.
Ooh, aren't there a certain number of days you have to do it within?
There's also days that you have to notify an employee that about their COBRA rights when they're first hired.
Mhm.
So they're waiting for a termination event, but yet there is a problem for not doing that with new hires. Like a lot of employers will just already have the COBRA notices in a new hire packet of notices. Having a COBRA vendor is an automated way when a new hire that those COBRA notices go out uniquely and separately to get you up to compliance. And that again comes to those, per day, $100 per day fines or higher dollar per day fines for violations. So, even if you have a company that doesn't terminate anybody, but you hire 6 people in a year and you don't provide that notice because it wasn't in your preset packet, you didn't have a COBRA vendor in there. And then some employee gets, sideways with you or another employee in your company and wants to wreak havoc. And, you know, I'm obviously stereotyping and downplaying and sensationalizing something, but this is the
It
trail that we've
happens.
seen happen
Yeah.
is that an employer gets, turned in for not following compliance rules because somebody is unhappy about something, either current or former employee. And then an audit is triggered. And that becomes one of the things that becomes all of the audit trail fines that you get in trouble for not doing. Those can be really expensive things when we're talking about, you know, $300, $600 a year, $1,000 a year, which is nothing compared to $100 per day per violation fine on just one person. And
Wow.
we're talking about all eligibles. So again, the monetary risk is huge. The monetary outlay to do it is simple. And when you have connected software systems like a payroll vendor system connected to a COBRA administrator or a benefits admin system or an HRIS, HCM system automatically connected to a COBRA administrator, where they get that data notification every couple of days of new hires and terminations, like it is automated as automated gets. So
Yeah.
getting it off of the employer, off of that HR team's plate is super simple.
Yeah. Are they also like if the email address bounces back or the mail is returned, are they notifying somebody and doing something?
Now you're talking about administrator by administrator
Right.
differences, and
Yeah.
some handle it differently.
Okay.
They are all mailed because that is the compliant way.
Right.
So
Mhm.
it is mailed to the address on file that keeps the compliance. If it is returned, different administrators will do different things based upon their service agreement.
Gotcha. Okay, cool. And then let's talk Medicare Part D credible coverage notices. What are
Okay.
they? Why do we need to send them? Who's responsible?
For sure. Medicare Part D credible coverage or creditable coverage notices.
Oh, creditable. Thank you for that.
Yeah, it's a
I'm not going to
saying.
edit that because I want people to know it's creditable, not credible.
Yeah. So when a person that's eligible for Medicare becomes Medicare eligible, they have the opportunity to enroll in a Part D prescription drug program. So Part D of Medicare is made of 4 parts, A, B, C, and D. Part D is the set of rules and regulations that allow for private insurance companies to sell a drug plan to Medicare eligible members. That is not 100% 65 and over. So there are sometimes pre-Medicare eligible members, even, someone that's had an organ transplant after 2 years becomes Medicare eligible. So you could be talking about a 30-year-old or an 18-year-old. So the problem is everyone thinks we don't have anybody that's 65 or over, it doesn't apply to us. The answer is it applies to everyone because that could be out there and there's no way you know about that for dependents of employees.
Mm.
What it is when those consumers are eligible each year, both when they're first eligible, when they first become eligible for Medicare, and then every year for the annual enrollment period for the drug plans, an employer is required to state whether their plan meets the actuarial threshold of being equivalent or better than Medicare Part D coverage. So if your employer plan is as good or better than Medicare Part D, you provide a Medicare creditable notice. If your drug plan is not creditable, say you do generics only and no brand names, you would provide a not creditable coverage. As long as your employer plan provides creditable coverage, an employee may stay on your plan and not enroll in Medicare Part D, thus allowing them to enroll in Medicare Part D later. That is where the late enrollment penalty under Medicare Part D comes in. And as long as they had creditable coverage, they are not subject to a late enrollee penalty for Part D. If they were not offered creditable coverage and they stay on your group plan and they enroll later into Medicare, then they are subject to that 1% of the national average per month they were not enrolled since they were first eligible penalty. So $3-4 per month for every month that they were late enrollee. So it is important for the team member, your team member as an employee, to know whether or not your coverage is going to get them out of a late enrollment penalty or subject them to a late enrollment penalty if they stay on your plan. So it's all about communicating whether your plan meets that threshold.
And so just to clarify for me, the fines or the penalty is on the employee, not the employer. So this is one where we're just doing the right thing by our employees, or we have to?
Both.
Okay.
So there is a penalty for not providing the notice as the employer.
Okay.
There is a penalty on typically your former employee once they've left your company.
Mm-hmm.
Then there's also someone left the company and they don't have their notices and they come to you asking for these notices. And if you don't have them, but you did it, it's really a pain in the rear to go figure it out, even if you did have them. So just doing it and having them available. And again, there's 2 spots for an employer. There's the notice and then there's the online submission to CMS.
Mm-hmm.
Both need to be done. So the notice posted or available to your employees by that, late in the year, October-ish deadline, November deadline. I'm fuzzy on it. I have to look back that they are provided. But every year when you renew your health plan, you will know whether you provide creditable coverage. So each year at renewal, just get that updated and have it posted so that when October, November timeline rolls around, it's already done. Like it should just be done within 30 days of the renewal. The online to CMS is supposed to be done within 60 days of renewal. So you're doing the online version or someone's doing it. The online version is fully voluntary, so there's no penalty for not doing it. However, you need to do it just to make everything work smoothly. But in that same workflow process, everything is done. And again, the notice letter is a form letter. There's two versions. There's a creditable, non-creditable, with a signature from you as the company administrator on it. It is a simplified letter. It does not take hardly any time if you know whether your plan met the threshold. Your carrier or broker or TPA should be able to tell you whether or not your plan met that threshold. Most employer group health plans do meet that category unless they don't combine medical and dental into the same plan and it's like a dental standalone, or it's one of the super high deductible HSA plans as a caveat, or it's a limited benefit or limited drug plan. Like I mentioned, some plans are teensy plans, small plans, skinny plans that only cover generics and not brands, and then that won't meet the threshold. So there are plans out there, and a single employer may have both a creditable and a non-creditable plan inside the same company. So it's important to note what you offer and how you're generating those notices.
Okay. And then is that something the employer normally does? Does their broker do it? Does their TPA do it? Do they need to pay somebody to do it?
It is typically done by the broker or their compliance vendor. The plans will do them sometimes. A lot of the TPAs have taken a hands-off approach that says you need to go find someone else to tell you whether it is or isn't. There are tools out there to put in the calculator and see whether your plan meets coverage thresholds of creditable, non-creditable. So again, it's not a overly complicated situation and can typically be done in under 15 minutes or less. So
If you know where to look.
if you know where to look and you have the tool, there are charts that most vendors give you of their plans, so you can check them out. Some plans will just give you a notice of if your plan is or isn't, or this plan is, that plan isn't. So there's a variety of different ways to get the information, but the end results are pretty easy.
And then do you normally pay for somebody to do that, or is that normally free?
Depends on the size and scope of your company.
Okay, cool.
Yeah. So the answer is it's all across the board. Some people pay, some people do it, some people just get it.
Yeah.
There's no reason for someone as a broker like me to charge for something that the carrier vendor just provides a notice.
Sure.
Like it's basically a pass-through document.
Sure.
There are other instances where there are consulting and actuarial things need to be run to verify it, like a more complex self-funded plan with a self-funded prescription plan where maybe the out-of-pocket maximum of the medical plan is run completely separate than the out-of-pocket maximum of the drug plan. That's a complicated area where fees and costs would probably be expected. An off-the-shelf Blue Cross Aetna plan or an off-the-shelf level funded plan, those are simplified. Like there's no reason to, if an employer has to just put their name on a form letter, I'm thinking you probably shouldn't have to pay for that.
Yeah, makes sense. And then from your perspective, why do employers skip these small compliance items? Is it lack of awareness, or do they make a decision that the risk is low, so they're not going to do it?
I think it's lack of awareness, really. There are so many things that our clients have to be worried about. These are small risk areas. I mean, we just talked about how they're not small risks,
Right. Yeah.
but the frequency of getting in trouble on these is not, I mean, COBRA is a little probably more than the others,
Sure.
but the frequency does not create a firestorm.
Mhm.
However, when we talk to an employer, we look at employer, or even go through our own plans, there's probably 10 very simple things between POP plans, COBRAs, Part D. You know, we talked some about ERISA wrap plans or having an overall arching summary plan design form, all the other required notices, you know, the genetics, the Women in Healthcare, the Mental Health Parity Act, those things. Again, there are tools out there that let you do it in under an hour's time for multiple things. you might as well try to knock off the 10 or 12 or 15 simplest items that are just easy to bite off so that you do worry about the other ones. So there's other tools, compliance audit reviews, those things are generally available, like the mineral HR checklist, going through just simply the Department of Labor's audit checklist. Like they provide one from the Department of Labor that lists about 50 or something, maybe 48 different items that they will look through in an audit checklist. Just work your way down through that and just pick off the easy ones to start with so that you can actually invest the time in the hard ones. So answering your question, that was long-winded.
Yeah,
Lack of
that's a good answer.
awareness, frequency of it becoming a firestorm is really those two, or just assuming it's been done. Like
Yeah.
a lot of people assume that a broker's done it. A lot of people assume their payroll's done it. A lot of people assume their outsourced HR has done it. And, we talk to a lot of people, it's never been done or it's been done, but skip to that next year. And those things become problematic. Also, if you're in a spot to start to sell your business, look for an investment partner. A couple of the first things they're going to ask for is proof of all of these compliance documents because they are looking for, what's out there as a looming penalty risk.
Yeah.
So if you want to make your company more valuable, don't be subject to potential penalties because they're looking at their investment dollars getting eroded for stupid mistakes. So
Right.
let's just fix the simple ones. I shouldn't call them stupid, simple mistakes.
So if people are listening right now and they're like, dang, we've got some gaps. What practical steps should they do right now to get their essentially compliance house in order?
Really, the easiest one might simply be that Mineral or Miratech HR compliance audit workflow.
Mm.
We have access to it for all of our clients. A lot of other people have access to the same tool. Happy to share that with anyone, but going through that one, or if you just want something for free, just go download the DOL's audit checklist. Like they provide it. It's free. It's for everybody. Just start working your way down it. And that becomes, your good first steps of making sure your house is in order.
Fabulous. Anything else our listeners need to know?
The other easy one would be on the 5,500 forms. So as an employer, if you have over 100 employees on a plan, then you are subject to filing a Form 5,500 every year with the Department of Labor. That tells you what you spent on the plan, how many people were enrolled at a point in time, whether it's the first day of the plan year or the last day of the plan year, and how much you paid for the plan, how much compensation was paid out to your service providers, your brokers, that broker's general agent, whoever was in there selling worksite benefits and on a revenue share split. Those kind of things are in the plan for both commissions and fees. And those have some pretty hefty penalties if you're a late filer. Those have to be filed within 7 months of the plan end. So it's so far after the fact, people forget it. It slips on the radar, and we've been guilty of it too. And it becomes a last minute fire drill. Those things are easily handled within 90 days of the end of your plan. So there's no reason to wait all the way till that 7th month. Just program it in there sooner. Also, those 55 or Form 5500s for groups under 100 enrolled employees are liable for like 401k and retirement plans that have funds in them. Your 401k or retirement vendors probably already handling it. Like those vendors are actually really good about making sure those things get done, but it applies to a wide variety of most employers. And so those are happening both on the retirement side and on the welfare benefits side. So that becomes an easy one. Self-funded, level-funded plans, there's the PCORI fees that are due each year in the end of July. So again, if you're fully insured, your insurance company's paying those for you. If you're level-funded, self-funded, you're paying a fee on those. Not getting those done become a penalty problem. They're easy to do. They're simple. Most carriers give you the report of what you need to send in. Those are quick and easy and fast. And then like RxDC reporting becomes more complicated. So your prescription data collection is a new one to be attending to. Those take some calculations. So those can take a little bit of extra time, and each vendor has a little bit different way they handle the calculations. So how to do them can be dependent on the vendor that's actually submitting the returns. And then the gag-clause attestation that's due at the end of the year before December 31st every year that says, hey, I swear that for our health plan and drug plan, there are no gag clauses or other things that we didn't know about in the plan where someone can't talk about the fees structure, how it's compensated. Like that, super convoluted, but actually getting it done is easy. Like the process to get it done is easy. Knowing that you don't have a gag clause in your prescription plan becomes like having to ask the questions like, okay, so we have a plan through Blue Cross, but who's our PBM? What is their contract? Have we ever reviewed that? Oh, dear God, we haven't, but we have to attest to this right now. Like those become steps you want to talk through before those happen. But again, they're easy compliance areas to take care of and the process to do it. The actual Rx data collection, that's the flip side, that's due first of the year, a little bit after the first. Those are more complicated ones that you would find in the fee structure for those, especially the self-funded plans where you might end up paying a $300, $400, $500 fee for those reports to go out on your behalf, because those are more complicated.
And these all can be found in both of those lists you mentioned? Maybe?
It's the RxDC and the gag clause reporting are a little newer in the last 3 years. So depending on where those live in the lists, on those audit lists, those may or may not be there. So I have not gone through a fine tooth comb on that DOL list to know. I'm making like a frown on the video.
Hey, at least people know they need to go look for it and make sure they have it.
Yeah, there's compliance calendars out there. I know I mentioned the mineral system, HR 360, if that still exists. I think that got purchased by Xywave. It may live out there, but both of those are good resources that are generally available. I have seen like the AI versions and the web vendors and the chat GPT stuff both have accurate and inaccurate information on dates on those. So I don't know that those are 100% reliable resources, but also pretty good starting point to then go, start on, but verify that the timing and information is accurate.
Yeah. Okay. And so if generous benefits clients are listening, they should just call their account manager, right?
Call their account manager, we'll work through it. Hopefully we've had conversations with them about it. If we haven't, it's probably because one of those rules might not apply to that specific client. But it is something that we do look at in the background on all of the clients based upon their unique, population.
Yeah. And then for non-clients, is it safe to assume that you could help them connect with Mineral and facilitate that?
That is a safe assumption. So we can set up those arrangements on a trial basis, limited basis, an ongoing basis, whatever they need. Happy to do that.
Okay. Fabulous.
Yeah. Also happy to have a conversation and say, you actually may already have access to this tool if XYZ are in place and you don't need to pay for anything. Like just educate you on things that your carrier vendors may have already provided for you. Because that does happen.
Right. You heard it on the Generous Benefits podcast. Bret will give out free advice.
That's what this podcast is.
All right. Well, thank you for your time, Mr. Brummitt.
Absolutely. Thank you for the good questions.
Big thanks to Bret Brummitt for sharing his expertise today and reminding us that compliance isn't just about big, obvious regulations. If today's episode sparked a realization or raised a question for you, don't wait. Double check your POP plan documents, make sure your COBRA processes are in order, and confirm your Part D notices are going out on time. It's these behind-the-scenes types of items that protect your business and your people. Thanks for listening to the Generous Benefits podcast. Until next time, I'm Amanda Brummitt. Here's to building benefits that work better for everyone.